Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites fewmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatments and surgery details when necessary for the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the Pallegra, diagnosis and treatment. Pallegra is a nutritional deficiency disease endemic among the poor peasants who subsist chiefly on maize. It is niacin content unavailable to the consumer. Etiology. The principal protein of the maize is deficient in essential amino acid tryptophan. Some cases may be found in people who are not dependent on maize. It may be found as a complication of chronic alcoholism. It may also be found in renal failure patients on very low protein and B complex and gastrointestinal disease leading to malabsorption. In an inborn error of metabolism, HARTNUP disease, tryptophan absorption is impaired and have Pallegra changes. Chemical pathology. N-methyl-nicotinamide, an excretory product of nicotinamide, decreases in urine. Reduced plasma tryptophan is reported in fasting blood. There is anemia and hypoalbuminemia due to dietary deficiency. Pathology. Dermatitis is there, and in addition there is a mucous membrane of the mouth, tongue, esophagus, stomach, colon, vagina show abnormal epithelium with underlying inflammation. Small mucus cysts or ulcers are seen in colon. In the nervous system, there may be chromatolysis of ganglion cells and patchy demyelination of the spinal cord is seen. Clinical features. General. Pallegra has been called the disease of 3 Ds. Dermatitis, diarrhea and dementia. It can develop with deficiency of niacin and tryptophan for 6 to 8 weeks and in patients with poor nutrition. Skin. There is erythema resembling the sunburn on the parts exposed to sunlight. On the back of the hands, wrist, forearm, face and neck. The lesion on the front of the neck look like V shape called castle collar or necklace. The affected areas are well demarcated from the normal skin. They are at first red, slightly swollen, may itch or burn. In acute cases, the lesion may progress to vesiculation, cracking, exudation, crusting with ulceration and may be secondary infection. In chronic cases, the dermatitis occurs as roughening, thickness, dryness, scaling and a brown pigmentation. Dermatitis of the vulva, perineum and perianal area are usually present. Nasolabial dysaphasia is sometimes seen on the face. Digestive system. Diarrhea is common but always not present. There may be anorexia, nausea, dyspepsia and echlorhydria. Glossitis is the first to appear. The tongue has raw beef appearance, red, swollen and painful. The mouth is sore and there may be angular stomatitis and chelosis. Non-infective inflammation extends throughout the gastrointestinal tract and leads to diarrhea. Rectum and anus are frequently inflamed. Nervous system. In mild cases, there may be weakness, anxiety, depression, irritability, and failure to concentration. In severe form, delirium is common in acute form and dementia in the chronic form. In chronic cases, there may be signs of degenerative changes in posterior and lateral columns of spinal cord. Diagnosis. Pallegra may resemble the sprue. Classical findings in an endemic area is a confirmation. The skin signs are specific diagnostic importance. Glossitis and perianal lesions are found. Treatment. Specific vitamin therapy. For a quick relief, nicotinamide is given in a dose of 100 milligrams every 4 to 6 hours by mouth. The vitamin is absorbed well by mouth despite the digestive disorders. Within 24 hours, the skin changes diminishes. Nicotinamide alone may not be sufficient. Protein and amino acid tryptophan are to be supplemented. Iron and folate are to be given. So, nicotinamide treatment is to be supplemented by nutritious diet high in protein, vitamin B complex tablets, iron and folic acid, and vitamin B12 may be supplemented. Diet. Food should provide 100 to 150 grams of protein in the form of egg, milk, meat or fish. 3500 kilocalories per day of carbohydrates are to be given to restore the patient to normal weight. Fruit juices should be given daily. General measures. Severely ill patients with marked mental symptoms are treated by giving rest and sedation. For dermatitis associated with crusting or secondary infection, gentle wasting with bland solution is indicated. If diarrhea is severe, treatment with tincture of opium and other measures. Prognosis. In long-standing cases, there may be persistent mental or spinal cord degenerative disorders. Occasionally, the fulminating form develops with fever and prostration, which may be fatal. Prevention. Fortification of bread and maize meal with nicotinic acid, improving the nutritional status of the population. Boiling the maize in lime water, environment of the maize meal with nicotinamide, etc. That's all about the Pallegra, and in the next video I will discuss about some other disease. Thank you.